Hello listeners and a warm welcome to Views on Health. Great pleasure as always to have with me on the program tonight Dr. KBC Janaka, consultant physician, Sri Jayawardhanapura General Hospital in Kotte. Warm welcome, Doctor. After a while you have come into our studios and being featured on the program. Pleasure to have you. And for the information of our listeners, the topic under discussion today is hypertension and hypotension. Hyper and hypo. Without any further ado, the microphone is yours, Doctor, to introduce the topic, hypertension and hypotension.
Good evening. Hypertension is what we know where the pressure is high. So, pressure should be high for your age and sex. But it's usually we take adults, male and female, are having both the same pressure. Usually younger females have slightly lower blood pressure. But in adults, we don't consider any male-female difference or age difference. Any adult who are having blood pressure more than 140 and 90 is considered to be having high blood pressure. So that is hypertension. Anybody, any adult having blood pressure more than 140 systolic and 90 diastolic, that is hypertension. In children it is different. They have their blood pressure according to the age, which I am not very familiar also, and we usually don't talk about that. Then hypotension is completely a different topic. So first, because we have asked about hypotension, I will talk about hypotension a little bit. What is hypotension? Hypotension is low blood pressure. So the low blood pressure, we usually consider if somebody is having a systolic blood pressure less than 90 as shock. So low blood pressure is not you have to take that blood pressure reading with all the other parameters of the person. Now if we take a blood pressure of a young girl who is about say 18 years old, then she might be having a blood pressure of 90 by 60 or in some cases 80 by 60. So if you take the parameter alone, the values alone, that is low blood pressure. But it can be normal for her. So we don't take that as low blood pressure. If somebody who had a normal blood pressure drops the pressure to such levels, then we say it is low blood pressure. So low blood pressure is not, we don't take it in day-to-day practice as a disease or illness. It varies from patient to patient. But say due to an illness as a secondary cause, say if somebody is having dengue shock or dengue fever, or somebody is dehydrated due to diarrhea, or somebody has bled, lot of blood out, then the pressure can drop. So in that situation, dropping from that person's normal value to a low value is considered low blood pressure. Otherwise, the normal blood pressure of individual can vary from person to person. It should be less than 140, but it can be low, but still normal. Usually, younger females have low blood pressure, lower blood pressure. It is not a disease condition, it is just that is the normal for her. So we don't try to treat her, we don't try to scare her, we just say this is your normal. So you don't have to do anything. But if it drops due to a secondary cause, as I mentioned, either blood loss or fluid leakage, then it is low blood pressure. Or sometimes rarely an overdose of blood pressure drug medication and also can cause low blood pressure. Overdose of diuretics causing a lot of dehydration can cause low blood pressure. Then it is a problem. Otherwise, low blood pressure is not a problem. So, in day-to-day practice as non-medical personnel, I don't think you have to worry about your low blood pressure. You may be having low blood pressure when you say it is low in the sense it is less than 120, but that is normal for you. If it is normal for you, that's fine. You don't have to worry.
Thank you, doctor. Now, if you say 120 is normal, and then anything that goes beyond lower than that, it could be normal for some people.
Yes.
And then, of course, you go up to 140 is considered high, and then it's calls for treatment or, medication, care anyway, of whatever called the doctor's prescription. Now, but just another clarification on the hypotension, which is the, what you say, the low blood pressure. Aren't there people who have it, generally their pressure is low and they are under some sort of medication? This is the question that some people have asked, because they say this is what they've been told, that their pressure is always on the low side. If so, I'm asking you then, what is the reason for that? And if that is a condition that some people have, not everybody, you said there may be causes to bring it down. Like
if it is generally low, that means it has been there for a long time.
Then what is the situation in that?
If the blood pressure has been low, in the sense it's low, it's less than 120. We can't say it's low. It's less than 120 for a longer period. That is probably normal for that person. So it's a low normal. We don't treat that. You don't have to treat it. They are healthy people. You don't treat healthy people. You don't treat values. You treat the person. So you don't treat the blood pressure value because the person is healthy. Rarely, there are rare diseases where your blood pressure can be low and you are symptomatic due to that. They are rare diseases. So I am not going to talk about these rare things which is there in 1 in million of the population. But majority they have low blood pressure. We can't say they have low values, but they are not symptomatic. They do their day-to-day activities normally, but you find that when you check the blood pressure, it is low. So it is a normal blood pressure which is lower than the other people. As I said, it's common among females, especially thin females. So it's a good sign actually. You don't have to worry about that.
Thank you for clarifying that, Doctor, because there have concerns amongst the general public. Some people have asked these questions.
I know when you go to a doctor with some other complaint, they check the blood pressure and they say your blood pressure is low. But that is, I think that it's partly that doctor is also not well aware of this situation. They have to understand that if you check the blood pressure, it can be less than 120 in many people, especially now if you do a, say, gynecological clinic, and if you get 200 young females coming, almost 150 will have blood pressure less than 120. So that is a normal thing. So that's our experience. So we are not worried about that.
Now you say they're healthy.
Yes.
And my question is, on account of that, the pressure going down to whatever level.
It's not going down. It has been like that.
Accepted. Going from that point onwards, will they have any sort of discomfort or anything? Because you're saying they're healthy, but they say, we feel lethargic, we feel weak, we feel drowsy.
I would usually look for some other cause.
For that condition? For
the complaint, rather than going behind the blood pressure.
Right.
Because to drop the blood pressure, if somebody drops the blood pressure, that is, if it has been, say, 140 and it has come down to 90 now, it's a serious condition. Somebody had dropped it from the normal value. Then it is a serious condition. We might put that patient to ICU. But in day to day, If the blood pressure has been low throughout, that is the normal for that person.
Thank you again, doctor. So going on from there, can I ask you, we have discussed this before, but to refresh listeners, the minds of our listeners, what are the general signs and that one would feel like the symptoms, or what would one feel when the pressure is going up? That you think, now I'm not feeling this is how I'm feeling, so I think maybe my pressure is up, I better go and see the doctor.
Yeah, first I'll talk about if somebody's, we have been discussing about the low blood pressure. If somebody is dropping the blood pressure, okay, they will feel faintish. Say, especially with dengue, if because they are fluid loss, their blood vessels are dilated. With any illness, sepsis or any infection, if the pressure is dropping, then you feel faintish. If you are dehydrated, you feel faintish. That is the main sign of dropping pressure, hypotension. But those symptoms won't be there in a normal person who has low blood pressure. High blood pressure is usually asymptomatic. That means you don't have any symptoms. So say blood pressure is, we say upper limit of normal is 140. Say somebody has blood pressure of 150 or even 160, even 170, they will not have any symptom. But say due to some rare causes, we know some conditions where the pressure can go up within few hours or days. Then they might get some symptoms like headache and other things. But generally, high blood pressure is something that where you don't have symptoms. If the pressure is very high, say more than 180 systolic or more than 110 diastolic, then it can cause headache, dizziness and things like that. But generally blood pressure of 150, 160, 170, even 180, which is chronic high blood pressure, you don't get any symptoms. That is why we want people to check their blood pressure regularly, because you don't feel it.
When you say regularly, from what age and how often?
Right. In Asians, we usually say that you should start your medical checkups, like medical checkups in the sense not doing all the unnecessary things, at least the blood pressure, blood sugar and cholesterol from the age of 35, right? At least if you do it in 35, then again, maybe in 5 years again, 40. From 40 onwards, annually, you have to check the blood pressure, blood sugar and cholesterol. If you have high blood pressure, then depending on the values and depending on the treatment you are given, you may have to check it more frequently. But if you don't have high blood pressure or sugar or cholesterol, from 40 years onward, you have to check annually.
So that's across the board for males or females?
Males and females both.
Now, getting back to the fact that younger people are today complaining of having high blood pressure, hypertension. They say that I was not feeling this, I'm not feeling that, and I felt this or felt that, and I've gone to see my doctor, and now he or she says, the physician says, now your pressure is high and you're under medication. Now, would you recommend or say that straight away of course depending on the condition or the severity of the condition, medication straight away, or first try to manage with maybe diet, exercise?
There are two things, especially young people.
Young as in how old, doctor?
Less than 35 years.
Okay.
Young people, we don't want to start them on treatment unless we are sure that they have high blood pressure. That is true for any person, but especially young people. Because it's very rare to have a person less than 35 years to have high blood pressure. It's a rare condition. Most of the time what we see is when you have some other illness or some other problem, or like maybe migraine, maybe vertigo, or maybe stress causing headache, you go and check the blood pressure that is high. It's not hypertension. That is reactive high blood pressure. as a reaction to the stress you are facing. So if you check the blood pressure and that is high, when you have symptoms, as physicians, we don't start them on treatment. We are not in a hurry to start treatment. We monitor, right? Unless it is very high blood pressure, we don't treat. We monitor. Usually the pressure drops gradually over the time, and then we see. But if somebody who is young is having persistently high blood pressure, a person less than 35 years having persistently high blood pressure, I would recommend that patient should go to a consultant. Go to a consultant physician and get all the investigations done to look for a secondary cause of high blood pressure. Now, high blood pressure, there are two main types. One is primary hypertension. That is where you can't find a cause. It happens with aging. With the age, gradually our blood vessels get thick, they become stiff, and the pressure builds up. That is primary hypertension. That you don't have a cause. So a person less than 35 years, usually they don't have this condition. They don't have primary hypertension because they are young. So if a person less than 35 years is having persistently high blood pressure even at rest on several occasions, then you have to look for a secondary cause of high blood pressure, which is a rare thing, but as consultants, we investigate them for like maybe kidney problems, maybe blood supply to the kidney, the kidneys are, the renal arteries are involved, maybe they are rare, the endocrine problems, those things. Electrolyte abnormalities or the genetic, we look for all the rare conditions where the blood pressure can be high in young people. So they have to undergo various investigations before putting on treatment if they are less than 35 years. Above that, with the aging, you can have high blood pressure. So in a elderly, if they come with high blood pressure, we usually don't do all these unnecessary, not unnecessary, all those rare investigations. We usually start them on treatment and just look for basic things like lipid profile, sugar, kidney functions and electrolytes and simple things. But we don't go for and look for other rare conditions to cause blood pressure in a normal adult who is having a slightly high blood pressure.
Doctor, now this is not exactly your field I'm going into. I'm talking about a pregnant woman.
Yes.
Now, they are concerned.
Yes.
The obstetrician, the gynecologist, they're concerned that her pressure has got to be stable.
Yeah.
And there are many, they are young, they're in their 20s, 30s, and they're pregnant, and their pressure does go up. Now, is it possible to comment on that, or would you rather say that...
Yeah, no, it's like this. Pregnancy-induced hypertension is a completely different thing. It has a separate mechanism. So that pressure comes not at the beginning of the pregnancy, towards the second and third trimester of the pregnancy. That is after the third month of pregnancy, the pressure can go up. That is due to hormonal changes and vascular changes happening in the placenta and the body. So that is treated, and it is treated aggressively and monitored. But then that pressure goes off as soon as the baby was delivered, and within 1 month the pressure should be back to normal. That is a completely different thing.
So that is absolutely not high up. Again, that's because of a cause. No? She's pregnant.
It's a different cause, yeah.
And therefore, for the various reasons, the pressure can go up.
It's a completely different reason.
Thankfully, it will come back to normal once the baby is delivered.
Yes.
Thank you, doctor. So, doctor, going on from there now, if you take this, hypertension is so common in Sri Lanka, maybe the world over. And people say, I'm stressed out. It's a general term that is used. Whatever you're going through, I'm stressed out. So it's like a cause. So what are the causes that bring this on?
The cause, number one cause is the aging. Older you are, your chance of having high blood pressure is high. Age. Then the gender. Males have high blood pressure more than the females. Then genetic background. Asians, Sri Lankans, Indians, we have high incidence of high blood pressure. Then comes the other things like stress, lifestyle stress, obesity, salt diet, smoking. Those are the main causes.
Alcohol?
Alcohol can cause high blood pressure, but not always.
Thank you, Doctor. Time has caught up with us. What would you say at this point in time to sum up this segment of our discussion?
I can say mainly 3 or 4 things. One, if you are young and your blood pressure is less than 120, don't worry. That may be your normal blood pressure, and you have to be happy about that. That's one. Number 2, if you are less than 35 years and if your blood pressure has been high throughout, you need a lot of investigations to look for a secondary cause. Don't just take treatment. Go and get investigated at a tertiary care level. That's the number 3. Then if your blood pressure is persistently high, more than 140/90, then definitely you need to go and meet a doctor and discuss whether you need treatment or not. Those are the messages that I have to give.
Thank you, Doctor. On that note, we end this interesting discussion on hypertension and hypotension. And thank you, Dr. KBC Janaka, Consultant Physician, Sri Jayavardanapura General Hospital in Kotte, for being with us on the program and sharing your valuable experience, expertise, all that put together with our listeners. Thank you so much. And may I invite you to come back with us on the program next week to discuss the treatment modalities and other complications that can arise because of hypertension.
Thank you.
Thank you, Doctor. Thanks also to Inoka Gamage for technical assistance. I'm Fatima Razikada saying good night and looking forward to your company next Monday, same time on Views on Health.